January 1945, Yokosuka Naval District. A cold wind drifts in from Tokyo Bay, carrying the smell of salt, burned timber, and medicine. The docks are scarred by air raids, warehouses reduced to frames of blackened steel. Yet inside a commandeered clinic near the harbor, the sound that dominates the room is not artillery or alarms, but metal instruments gently clinking against enamel trays. White lights hum overhead. Hands move with precision. For the civilians waiting on wooden benches, this sound, soft, orderly, unhurried, feels unreal. For years, Japan's home islands had been conditioned for scarcity and sacrifice. Medical care was rationed, hospitals overwhelmed, and civilian suffering framed as a patriotic duty. By late 1944, Allied naval power had choked supply lines, food shortages spread, disease followed. American warships, once distant silhouettes on the horizon, now anchored in Japanese waters. What followed would quietly challenge everything civilians had been told about their enemy. The arrival of U.S. Navy medical units in occupied ports and coastal cities marked more than a logistical operation. It was a deliberate policy. American planners understood that the war would not end solely through firepower, but through perception. The Navy's Bureau of Medicine and Surgery deployed doctors, nurses, and corpsmen not only to treat prisoners of war, but civilians, without charge, without discrimination. Clinics were established near ports like Yokosuka, Sasebo, and Kure, often using salvaged Japanese facilities restored with American supplies. Japanese civilians had been warned for years that Americans were brutal, racially motivated, and indifferent to Japanese life. Propaganda posters depicted them as monsters. Rumors spread of medical experiments and deliberate neglect. Many civilians expected humiliation, pain, or rejection. Some arrived to the clinics only because illness left them no choice. Others came out of curiosity, standing at the doorway, hesitant to cross the threshold. What they encountered instead was abundance. Bandages were clean and plentiful. Bottles of penicillin, still rare even in parts of Europe, were opened without hesitation. Surgical gloves were discarded after a single use. Doctors washed their hands repeatedly under running water. For civilians accustomed to shortages, this alone was astonishing. The recurring symbol of this moment was simple: a small white tablet placed gently into a paper cup. Medicine, given freely, without ceremony or demand. American medical records from early 1945 document thousands of civilian patients treated in naval clinics. In Yokosuka alone, Navy physicians recorded treating respiratory infections, malnutrition, burns, shrapnel wounds, and chronic diseases neglected during the war years. One U.S. Navy report noted that civilian turnout exceeded expectations within weeks, despite initial fear and mistrust. The treatment was not symbolic, it was thorough, methodical, and often life-saving. Japanese public health officials observing these operations were struck by the scale. Navy doctors carried mobile units into bomb-damaged neighborhoods, vaccinating children against typhoid and smallpox. Malnourished patients received vitamin supplements and caloric rations alongside medical care. Food and medicine became inseparable in these encounters, reinforcing the same message: survival was no longer conditional on obedience or ideology. The emotional contrast was profound. Civilians who had endured years of military hospitals where resources were scarce and pain accepted as unavoidable now saw wounds cleaned carefully, infections treated aggressively, and recovery prioritized. Many expected punishment, instead they received patience. Many expected indifference, instead they encountered quiet professionalism. Historical evidence supports the psychological impact of these actions. Post-war Japanese surveys and memoirs frequently reference medical treatment by Allied forces as one of the first moments when wartime narratives collapsed. Sociologist John Dower later noted that medical aid played a critical role in reshaping civilian perceptions during the early occupation period. The enemy, once imagined as cruel and distant, now appeared structured, organized, and unexpectedly humane. This experience transformed more than individual health, it altered worldview. For civilians raised under a system where resources flowed upward toward the military, the sight of doctors serving ordinary people without cost challenged assumptions about power. The white tablet became a symbol not just of medicine, but of a system capable of producing enough to give away. American abundance was not theatrical, it was procedural. Supplies arrived on schedule, equipment was standardized, records were meticulously kept. This quiet efficiency carried ideological weight. Democracy in this setting was not debated, it was administered. The sound of metal instruments clinking against trays returned again and again in civilian memory. It replaced the sound of air raid sirens. It suggested order after chaos, care after neglect. That sound echoed far beyond the clinic walls. Not all reactions were immediate acceptance. Some civilians refused treatment at first, suspicious of hidden motives. But as recovery followed care, skepticism faded. Parents brought children. Elderly patients returned for follow-up visits. Trust, fragile and tentative, began to grow. By the war's end, American naval medical units had treated tens of thousands of Japanese civilians. Their work rarely appeared in headlines. There were no parades, no speeches, yet its impact endured. It demonstrated that power could manifest as service, that victory could include restraint, and that strength could be measured in preservation rather than destruction. In later years, many Japanese civilians recalled these clinics as their first encounter with a different kind of authority, one that did not demand sacrifice without return. The white tablet, once an object of disbelief, became a memory of survival. As the war receded into history, the broader truth remained. Empires rise through force, but perceptions shift through care. In a ruined port city, under flickering lights, medicine crossed an ideological frontier. And in that quiet exchange, hand to hand, tablet to cup, the meaning of abundance was redefined not as excess, but as the ability to heal without asking anything in return.